So you're ready for your procedure, huh?
More than ready.
Are you nervous?
I'm actually not nervous at all.
What was it that really made you decide to have liposuction by the tumescent technique, the local anesthesia technique?
Well, I told you before, I've been a triathlete for a year. I work out a lot. But even after races, I would see that nothing had changed. I'd work out a lot, and the same places would look exactly as they did before, while other parts of my body were obviously getting in shape. And I just felt like I wanted my body to reflect the fitness level I'm actually at.
Yeah, it gets very frustrating as we get older when there's areas that are truly resistant to diet and exercise. And it's easy to do when you're 18, 19, 20 years old, but unfortunately as our metabolism slows down and we settle into the everyday routine, there's areas that really just stay kind of socked in there.
Yeah.
And that's where a minimally invasive technique like this tumescent technique really comes in handy in getting your body back into proportion, and then it just kind of stays there as you go through life. All right. So you're back. 1 week after your first procedure, and gosh, you look great. It's an amazing change for 1 week after surgery. So we did your full abdomen and your waist and hips all the way around. Swelling is pretty minimal in you at this point, and your incision sites are almost not even noticeable 1 week out. So what day was the worst part of the recovery?
Day 4, I think. I was hugely just swollen and bruised, and my boyfriend's taking care of me, and I thought, what does he think? And,
Yeah.
but it's ever since then, it's just been very
And that's typical. That's the way that these cases go almost to a T, is that you look immediately better the day or two after the procedure, and then you start to swell a little bit, kind of go in the reverse direction. But now, 1 week out, you're kind of way back down, and each day after this is just going to keep shrinking down more and more and more. So today we'll continue with the procedure, and we'll do the back of your arms like we talked about, and we'll finish off the reshaping to bring your lower half of your body into harmony with the upper half. And whenever I do arms, I usually make 2 incisions, one little tiny incision here and one right here. And I always include taking about a little bit of this fat. This really bothers women. It's not so bad when it's right here, but if you have fat on your arm right here, you almost always have a little bit of fat, what we call the armpit fat or the posterior axillary fat pad. So that becomes magnified when you put your arm down to the side, and it kind of sticks out right there in clothing. So we like to feather that down a little bit as well. Get this little chunk of fat right behind the armpit here. Yeah. No, that's nice. Like I said, it's really important to get that little part right back behind the armpit. You're saving your arms by doing this. Your arms, because you do accumulate tendons and genetically just accumulate some fat there. So you're saving your arms because that skin that weight takes its toll over time, and it starts to just stretch that skin out. The sooner you can get on it. What's going on, my dear? You like hanging out with me. It's got to come to an end. Down, arm straight out to the side. This is very important as well. It allows us to do a final check to make sure we got things the way that we want it. Allows me to really see you in a proper anatomic position to see if your arms are nice and symmetric, because that's the biggest thing you're going to look at later, is to say, gosh, are my arms even after I'm done with liposuction? I think we need a little bit more off this arm, okay? So we'll lay you back down. All right, we're finally done. How do you feel?
I actually feel great.
It's kind of a lot to go through when we do that many areas over the course of a couple of weeks, but I'll tell you, it's going to be well worth it, and you did really, really good with the procedure. Congratulations.
Thank you.
And I'm going to see you in about 1 week for your follow-up for the arms, the inner and outer thighs, and then we'll see you in about 3 months where we'll come back in and we'll document all the changes that have been made.
Great.
In the meantime, just follow your instructions very carefully, what we gave you in the post-operative care. You can be fairly active for the next week, if not anything other than walking. And then in about 3 weeks, you can get back to your full normal activities. Okay? You call me if you have any other questions. All right. Yep.